Hello, welcome to the MidState Medical Center new Pyxis and ketamine rollout video. This is for Hunter's Ambulance paramedics and Wallingford Fire Department paramedics. Connecticut OEMS statewide guidelines added ketamine to the paramedic formulary in 2016. Evidence-based medicine has shown that ketamine use in cases of excited delirium works faster and is more effective than any of our other benzodiazepines. Ativan is being removed from MidState paramedic controlled substance kits, and ketamine is being added on May 7th, 2019. So what is ketamine? Ketamine also has a brand name Ketalar, is a dissociative anesthetic, meaning it blocks sensory perception, that has been available by prescription in the U.S. since the 1970s for human and veterinary uses. Dissociative drugs can lead to distortion of sights, colors, sounds, self, and one's environment. It is available for IV and IM injection. Ketamine can provide pain relief and short-term memory loss. In surgery, it is used as an induction and maintenance agent for sedation and to provide general anesthesia. It has been used for pain control in burn therapy, battlefield injuries, and in children who cannot use other anesthetics due to side effects or allergies. This drug is also under research and holding promise as a treatment for severe depression in difficult cases. It is often preferred as an anesthetic due to a lower chance for depressed breathing, as often occurs with opioids. Here's the drug card for ketamine. As you can see, the indications are extreme agitation or combativeness, suspected excited delirium, ineffective control of agitated patient after benzodiazepines, moderate to severe pain, sedative used in rapid sequence intubation, post-intubation analgesia, post-intubation sedation. Its only contraindication is allergy. Its dosing for restraints is 4 milligrams per kilogram IM. We're going to round to the nearest 50 milligrams. Max single dose is 500 milligrams. And you may administer an additional 100 milligrams IM in 5 to 10 minutes after. The IVIO dose is 1 milligram per kilogram over 2 minutes. You may administer an additional 0.5 to 1 milligram per kilo in 5 minutes for a max dose of 2 milligrams per kilo. Pain management, it's 0.3 milligrams per kilo IVIO IM, maximum of 30 milligrams. RSI is 2 milligrams per kilo IVIO. Post-intubation sedation is 1 to 2 milligrams per kilogram IV. Post-intubation analgesia is 0.3 milligrams per kilo IVIO. For MidState Medical Center, our ketamine guidelines are going to be on standing orders. You're going to have it for excited delirium, agitation, post-intubation sedation. You can also request ketamine via medical control for traumatic injuries for an adult when the amnesia properties of ketamine would be beneficial to patient care or in a situation where opioids are contraindicated. Here's an excerpt from the Connecticut statewide guidelines for 2019 for excited delirium. You can see in the highlighted portion it says ketamine is preferred, 4 milligrams per kilogram IM. We're going to round to the nearest 50 for a max dose of 500, as we mentioned before. You may administer an additional 100 milligrams of ketamine IM in 5 to 10 minutes, or if you have vascular access, you can administer 1 milligram per kilogram IVIO over 2 minutes, and you may administer an additional dose of 0.5 to 1 milligrams IVIO in 5 minutes for a max dose of 2 milligrams per kilo. Okay, benzodiazepines are still authorized, however, ketamine is preferred. As you can see from the PEARLS section of the statewide protocols, a couple things to be considerate of when you're administering ketamine, or even to help you kind of make a decision as to when to give it. If your patient is continuing to struggle against restraints, let's say you got them down, you got them into a 4-point restraint, maybe you didn't have to give them anything, but they're struggling. That increases the risk for hyperkalemia, rhabdomyolysis, which can cause cardiac arrest. So you might want to consider chemical restraint on these patients who are still forcefully struggling against that restraint. If you push ketamine too rapidly, you're going to increase the risk of respiratory depression and apnea. So as we said earlier, ketamine can be used in post-intubation sedation. However, it is in adults only. So no children should get ketamine for post-intubation sedation. The Connecticut statewide guidelines for 2019 give some of the doses here. You can see ketamine, the dose is 1 to 2 milligrams per kilogram IVRIO. And then for analgesia, ketamine, 0.3 milligrams per kilogram IVIO or IM. And again, for analgesia, you need to contact medical control. However, for sedation, you can have it on standing orders. Post-sedation requirements for ketamine: cardiac monitor, 12 lead if possible, end-tidal CO2, and SpO2. So whether you're using ketamine for sedation on an excited delirium patient, or you're doing a post-intubation sedation, all of these things should be utilized on your patient. That's it for the information on ketamine. There is going to be a quiz available in the MidState EMS room or at your service supervisor and or training officer. Quizzes are due by 5/6/19 at 5 p.m. so that we can roll this out on 5/7/19 in the morning during NARC inspections. In addition to ketamine, there'll be a new Pyxis procedure beginning May 7th, 2019. Some of the changes with this new Pyxis: there's no paper sign-out when removing kits. All unused kits will be returned to the Pyxis. Used and expired kits will be placed in the external bin still, and there'll be a sign-in sheet only. So you'll only have to sign in kits, and then used and expired kits will be the only thing being placed in the external bin. All right, removal of kits. So part of this procedure, you're going to log into the Pyxis, same as you always do. You're going to enter the remove button, same as you do now. Choose your agency. You're going to choose a kit. All the kits will be numbered. Choose your quantity of 1. The drawer and pocket will open. You're going to enter the beginning count that's in the kit. Typically, it should be 1. You're going to hit accept. You're going to remove the kit. You're going to enter the removed amount, which is 1. You're going to close the pocket, and then you're going to close the drawer, and then you're going to exit the system. That's going to be the procedure for removing kits. All right, return of unused kits. You're going to log into the Pyxis. You're going to enter return. You're going to choose your agency. You're going to choose your kit number, same one you have, so kit number 210, say. You're going to choose the quantity of 1. You're going to the drawer and pocket will open. You're going to enter the beginning count, which should be none. You're going to put the kit in. You're going to enter the returned amount, which will be 1. You're going to click accept. Confirm kit expiration date and accept. So just make sure that the expiration date that's on the screen is the same that's on the kit. You're going to close the pocket. You're going to close the drawer. You're going to exit the system. It's going to print a slip. You can discard that slip. And then you're going to log the return into the book, same as you do now. Used and expired kits. The Pyxis will not be used. You will just take your expired kit, you will put it in the external bin, and then you will log it into the return book. So this is the process we do now, with the exception of actually logging into the Pyxis and returning the kit.